So we're going to go straight into a one-on-one interview. We have virtually Cynthia Kahumbura. She is the Kenya Country Director for Jacaranda Health, which partners with governments to deliver affordable and scalable solutions through government hospitals where the majority of underserved mothers and babies receive care. So Cynthia, thank you so much for joining us today.
Thank you, and I'm really delighted and honored to be here with the interview and to join virtually.
Great. So, well, let's dive in. Cynthia, what do you see as the biggest threats to achieving SDG 3 targets in Kenya?
Well, currently right now, based on our 2030 SDG targets, we're actually currently a double where it should be. But we have made some strides. And on the one hand, we've been able to see access has clearly increased, and we're seeing more Kenyan women are now choosing to deliver in facilities than ever before. And the government, through universal healthcare coverage, has actually implemented a national insurance scheme called Linda Mama that improves equity in healthcare access by offering maternity and newborn services for free, whilst reimbursing the facilities delivering these services through claims. However, on the other hand, a significant impact has been really in the quality gap in the health system, and which has been stalling our progress. And we've actually been seeing in recent years that the maternal mortality rate has actually across the country plateaued. And this has, as mentioned, has really been around, and I think you mentioned earlier, not just access, but being able to receive high quality services during childbirth.
So now, to follow up, can you talk to us about this quality gap, why that is, and what you're seeing play out on the ground?
Yeah. So we see a couple of major issues driving this quality gap, but really it's mainly around resource allocation and also data collection. Most underserved women are supported by the public health system, but under 30% of counties' health budgets actually goes towards these public facilities that are providing these services. Local governments have available resources, but they're struggling to identify and use the resources available to them to efficiently and effectively prioritize MNH health system strengthening to really impact these maternal mortality outcomes. And we've actually been seeing finances financial revenues being collected from health services and being redirected into other sectors such as infrastructure instead of being plowed back into the healthcare system. We've also seen that money is actually being left on the table. As I mentioned earlier, Linda Mama, which gives counties and facilities this additional revenue stream to plow back into improving quality, they actually are not fully utilizing it. For example, in Kakamega County in 2020, primary care facilities only claimed 15% of their potential revenue. And what does that mean? They were actually leaving $2.9 million on the table, which could have been reinvested in improving quality of care. The second aspect is, as I mentioned earlier, is really lack of visibility into collated data across the whole health system and the mom journey, really from ANC through to delivery and PNC. And some of this data is around emergency transport, blood supply, and also quality of care. This is not to say that the data is not being collected. It is being collected, but it is being presented in silos. And from this, what we're really seeing is around another big gap that we've also identified has really been the absence of client data. And really, this is where the mom's voice comes into it and what they are experiencing in terms of services. And in Nakuru County, we actually have our head nurse in a high volume facility called Christine, who didn't quite understand why her patient numbers were dwindling. And it wasn't until we introduced our digital health tool prompts that she was then able to see what's actually happening on the ground, and be able to reference the data around what are moms saying when they attend their ANC visits, ANC and PNC visits, and also what's happening at the delivery. And once we provided Christine this data, she was actually able to link reported cases of abuse with specific providers in her facility. She was also able to dig into the insights and learn why were clients struggling to make their appointments, and what was happening also in terms of service when they do come and experiencing long waiting times. And it's through this issues that she was being able to identify these issues, that she was actually able to resolve them in a low cost and low resource way, and actually see her volumes and her quality of care scores improve by 40%. And therefore, we're really seeing by combining these key data insights coupled with financial resource allocation, we can see facilities and counties actually improving in their quality of care services.
These are an interesting mix of problems, leaving money on the table, lack of data that I'm sure are relevant to so many different organizations. To wrap up here at UNGA, if there's one message you wanted to send across, a call to action, if you will, what would it be?
For me, it would be, we hope to really see a more integrated approach towards building health systems, and a shift from donors, local governments, and private partners such as ourselves, working on the different pieces of, shifting from working on the different pieces of the health system in silos, but actually combining our solutions. And we're already seeing, the establishment of communities of practice and various other initiatives, which actually involve the three key partners. And really for us, our first ask is looking, seeing continued investment in innovative M&H solutions as the building blocks for really building this resilience around building health systems. And in the recent past, we've actually seen donors are reluctant to fund health systems as a whole because it's too broad. But we're excited to see organizations such as MSD really thinking about this and explicitly funding it through the strengthening systems for safer childbirth. And also working a lot with locally established and embedded organizations such as ourselves to join forces and address often siloed issues that mothers are facing across the health system, and bringing them together.
Great. Thank you so much, Cynthia. And on that note, next up, we're going to present a video. I believe that also features you, which where we'll hear the voices of the partners and the healthcare workers from the new Strengthening Systems for Safer Childbirth, talking about what women in their communities need for better maternal health.